And we are live on YouTube. It's Dr. J here in the house. Hope everyone's having a phenomenal Friday. What's going on? What's on your mind? Let's dive into some questions. I'll give it kind of a few minutes for everyone to show up and to get into the house here. And we'll get moving. I'm sipping on some ginger tea right now. I had a little dry throat. My son had a little cold, so I'm on top of it. And I had it like nip last week, killed it. It came back just a tiny bit, and I'm knocking it right back down. My ginger tea recipe is phenomenal, by the way. You just take 2 or 3 pieces of ginger root, and you're going to just blend that up. You're going to add about 12 to 14 ounces of hot water. You'll add about a teaspoon or so of honey, and then you'll do half a lime or lemon. Squeeze that in there. It is great, and it's really anti-inflammatory, really soothes the throat, really good antiviral as well. So I basically just put it in one of these big guys like this and just sip it throughout the day. That's it. Also got my little throat spray here, which helps too. There's some good antimicrobial herbs for the throat. All right, let's dive in. Sean wrote in, good morning, Dr. J. Interested in working with you. I've done a handful of tests from the last couple of years and some over the last couple of months. Got it. Cool. If you have a question, let me know. Lambert writes in here, what about using an elemental diet for large bowel dysbiosis? Should any antimicrobial supplements be stopped while being on the elemental? It just depends. Typically, I would use... you can do antimicrobials while being on the elemental. It just depends what's going on. But elemental is great because it just takes everything that's all broken down. There's no fibers in there at all. Everything's broken down. You're getting all the nutrition you need as well. Because it's all in really good amino acid form and or vitamin mineral form. And that works great. Elemental is shown to knock down SIBO 80% in 2 weeks. So it's really extreme. So I don't use it all the time. But it's a nice tool in the tool belt to kind of pull out when needed. So I do like it. Is there a way to advance the treatment if I come in and with some advanced knowledge of where I need to go and also have labs? It just depends. It just depends what labs are done. It just depends kind of where you're at, what your symptom presentation is. But definitely everything is kind of taken into account. And then when I meet with each patient, we go over the labs, at least the more recent labs within the year. We review diet, lifestyle, kind of where you were when you got sick, how much momentum you have from where you were at your sickest to now. All of that goes into kind of figuring all that out. Hey, Ashley, I'll be talking to you really soon. Can a cytokine storm happen during a candida die-off? It's possible. I mean, there's mycotoxins that are released during candida, so it's very possible. I always recommend if someone's autoimmune or very sensitive, we would ratchet up clearing herbs very gently, and then we may throw in some binders as well to soak up any of those mycotoxins that are released. That can be super helpful. Jacqueline writes in, I have a question. If when sleeping you scratch your throat, is that parasites? Not necessarily. It could be other things. It could be just generalized bacterial issue that's coming out from the environment. And, you can do the ginger tea and you can do silver apple cider vinegar. All those things are phenomenal. All really, really good. Excellent. Alexis writes in, what's your approach to addressing high ochratoxin in a child? Well, number one, figure out how the ochratoxin got there. So typically that's going to be a mycotoxin for mold. So you got to look at the house. Where in the house is there a mold? Is it a humidity issue? Is there a leak issue? If the root cause of the leak or the water is addressed, now have you remediated the mold? I did a great podcast last week with JW from Immunolytics. Take a look at that podcast. Really, really, really great information in that podcast. But if we have the ochratoxin there, air filters, activated charcoal, glutathione, all the whole 9 yards, and we have to do it according to where kind of you're at. So you really need to customize that. But listen to that podcast is a really good starting off point. Do you have any recommendations for specific nutritional coaching programs for anyone interested in becoming a health coach or a certified nutrition? Which ones do you consider? So there's 2 kinds, right? There's like didactic, like you're just getting the knowledge, you're just getting the information. That's like step 1. And there's different courses like NTP or Institute for Functional Medicine. There's different courses. Then there's like courses that like, how do you put it all together? Because if you don't have the information, if you can't apply it to help a patient, regarding programs, and you can't sequence things out, and you don't have a business model where, if the patient's here, I need to get them there in the next 3 or 6 months. How do you do that? Because most people, they're kind of just like, they have all their information, it just comes out all at once. There's no sequence, there's no plan for the person over the next 3 to 6 months. That's where people and patients get lost, because you can't do everything at once. You have to start incrementally, and your body can't handle everything at once. So that's the hardest part. And then, patient management. How do you deal with patients to keep them motivated, to keep them compliant? When they get overwhelmed, how do you help them? You need all the resources to plug in together. So there's like level one, like get the information. And then there's other courses that help more with patient management. And then plugging in the clinical model is number two. So you can have all the information here, but you got to plug it into a model here. So I'm going to be doing a program that deals with, the model part and the management part, because I think that's the most important. You can have all the information, but if you just like come at a patient like a fire hydrant and just get them all just too much information, they're going to be overwhelmed and they won't be compliant. Let's see here, guys. Dr. Kalish is a good resource, by the way, for another functional medicine program. Very actionable. Thanks. We'll book something today. Is there a relationship between anemia and MTHFR? There can be, especially on the B12 side, for sure. On the iron side, probably not as much. Iron could be malabsorption based. It could be just vegan, vegetarian, not eating enough, or it could be estrogen dominance if you're bleeding too much menstrually. Great, Ashley. Kelly writes in, husband found light red round rash on my lower middle back, the size of a baseball. Any home remedies to clear this up? Looking forward to my appointment with you next week. So how did it all happen? Like, what was going on with it? Is it like an eczema kind of thing? What do you think? I mean, you could always topically rub some coconut oil on it or some melaleuca tea tree oil on it. You could also look at histamine, cutting down some histamines in your diet. If there's if it's like a urticaria, hive, or wheal kind of thing, it could be a histamine issue. You can look at those two things and we can talk about it more. Is it possible that diatomaceous earth can cause hair shedding? All labs are fine. Hard to say. Probably not. Diatomaceous earth is mostly silica, but it can bind up and kill worms. So it just depends if there's stuff that's maybe being killed and dying off. But I would say no. There could be other things going on. Marsha writes in, can low stomach acid cause hormonal imbalances? Yes, it can, because if you're not digesting your protein and fat, essentially in your cholesterol, because cholesterol comes with protein and fat typically, then you're not going to be able to have the building blocks to build up your hormones. So yeah, it's very possible. Why is real salt so gritty? Is there a way to reduce the grittiness? I mean, I like it. I think it's really good. It's really fine. Fine grind. I like it a lot. Fine grind. Fine ground, I think. Yeah, that's it. I like it a lot, but there's others. You can get a fine ground Himalayan or a fine ground Celtic. Play around with it, but I love the real salt. Mo writes in, what supplements do you recommend for headaches that are induced by loud noises? It's a great question. So why would you be sensitive to loud noises? So I would probably look at getting the adrenals under control, getting the stress hormones under control. You can always do things like feverfew and magnesium and ginger are really good things to relax the headaches, and then a really good massage to work on a lot of the muscles in the neck that refer up into the head. What's your treatment approach to chronically high cortisol? Have been addressing gut issues, but cortisol remains high. So yeah, you have to look at the diet and lifestyle stressors, food, lifestyle stress, sleep, see where those are at, and then using good calming herbs to calm the cortisol down. That could be ashwagandha, phosphorylated serine, magnesium, GABA. It can be a combination of those. Holy basil, all those can be helpful. What brand of PQQ do you recommend to take in addition to your Mitosynergy? What dose? PQQ, I typically recommend 20 milligrams a day. There's one that I carry as well. It's a special order product. I forget the exact brand. It comes with a little bit of CoQ10, but 20 milligrams a day. PQQ is excellent. That's pyral something quinolone. It really helps with the mitochondria. Any good beetroot powder you recommend? Standard Process does have some good beetroot powder. I know that comes from an organic source, and beetroot can increase nitric oxide, which is helpful. Susan writes in, is serapeptidase safe to use daily, using for aiding sinuses, clogged ears, and helps a lot? Yeah, I do like it. Daily, I mean, every day forever, probably not. You probably want to take breaks on it, but can you use it months at a time? Yeah, serapeptidase is great to use months at a time, just to clean out arteries, clean out scar tissue, help reduce inflammation. I do love serapeptidase. That's excellent. Can white rice be eaten every day without developing a food sensitivity to it? I probably wouldn't eat any food every day that's the same thing. If you love it, rotate it. If you love it, rotate it. Just because if you have gut health issues, it can always slip into your bloodstream and your immune system can create some kind of an immune response to it. But just do your best to rotate it, especially grains. I'm not a big fan of a grain being a staple for most people. You're better off looking at a safer starch like a squash or sweet potato or plantain or even white potato. White potatoes are actually very nutritionally dense, very high in potassium. Very good. I'm actually going to have some supplements right now while I wait for a question. I got a consult here with Ashley coming up next, so Ashley and I are going to chat. I got to do one little thing in between. I'll kind of cue you guys up for a few more questions, and let's see where we're at. All right, Sue writes in, can I ease into the autoimmune diet? I tried it for one day and feel really weak with low blood sugar feeling. I'm so glad we're working together on my health issues. Thank you. Yeah, absolutely, Sue. So you can just try doing paleo for the first week if you're having a hard time with the autoimmune. If you're feeling really weak, though, based on kind of knowing your body type, you may do better adding more carbs in there. So a lot of people, when they go to AIP, a lot of times they also go really, really low carb too. And if that's the case, you may need to work on popping up the carbs. So look at having a medium-sized bit of sweet potato or some squash or some zucchini. Add some additional, more starchy carb sources in there. If you have to eat a little closer to meals, that can be helpful too. Try to go 4 hours, but if you're getting jittery or hungry, then, ease it back to 2 or 3 if you need. So just do your best with that, okay? And you can do paleo to start and progress to autoimmune over the next 2 weeks. Agnes writes in, is it okay to take holy basil, ashwagandha, and rhodiola daily? Yes, it is. Is a CT scan enough to diagnose gut issues? No. I mean, maybe if you're looking for like a tumor or something, I still think the gold standard may be an MRI over a CT, but no, I mean, that's going to look at the very overt kind of things, a tumor growth, those kind of things. Even that, I think you would still need a scope. So yeah, that would not be your best go-to regarding a lot of functional issues and imbalances. Alexis Walbridge writes in, will you and Evan do a podcast on food recommendations on a paleo diet? Meal ideas would be helpful. I've done some podcasts on these things before. I typically don't do a lot of those type of things, but we can definitely look at chatting about like what we eat and just kind of giving recommendations kind of on our diet side. That's fine. If you wake up in the middle of the night, what is the best protocol to get back to sleep? It depends on about how many hours you have to sleep. So if it's like 1 or 2 or 3 a.m. and you are waking up at 7 and you got 3 or 4 hours, fine. Easiest thing would be some sublingual melatonin. I have a bottle of melatonin on the corner of my desk or on the corner of my bed. So if I ever wake up, I do have it as an option. So that is an option. I typically don't wake up, but if I do, I just take 1/3 of a milligram. Sublingually, get it right in my mouth fast. Can I have limited white potato? Well, if we're going to do a paleo template to start, yeah, white potato would be allowed on a paleo template. When you progress to autoimmune, though, it would be taken off because potatoes in the nightshade family, Sue. Hope it helps. What can be a reason why someone ages really fast? Well, it's typically going to be oxidative stress. And oxidative stress is going to be fueled by lifestyle stress or emotional stress. More importantly, with not getting enough nutrition. And then number 3 would be toxins, things that fuel oxidative stress. So high blood sugar would be a toxin. Pesticides, chemical, abnormal hormones in food. So the food quality, if the food quality is not there and we get lots of toxins, those are going to create oxidative stress. Oxidative stress will damage our DNA and cause accelerated aging. Makes a big difference. I mean, you go back to your 20-year high school reunion, you can see the people who took care of themselves and who didn't take care of themselves. My expression, my subconscious expression, when I see people who have aged seriously, I'm just like, their biochemistry and their hormonal system has tanked. They've stressed it out. They've tanked. Insulin resistance is set in. Collagen is degraded. Hormones have kind of broken down. And it really shows in people's energy and then also their skin and their hair and everything. So don't be that person. Try to apply the information I'm telling you here, and that's going to be huge. Why does psychosis cause lack of motivation? Well, I mean, what are the symptoms of psychosis, right? It's going to be usually a combination of anxiety, depressive, manic, all these things. If you don't have those type of good cognitive function, it's hard to be focused on something and be able to be motivated and do it. So you need good cognitive focus, good cognitive energy to be able to be motivated. So it's just part and parcel of having those symptoms, right? People that do really well in life, they usually have energy to do it. They usually have the cognitive ability to focus on it, and that takes a lot. You're welcome for these chats, Alexis. Absolutely. Sean, how do you clear blocked detox pathways? First thing is take away what's stressing the detox. So make sure the food, chemicals, hydration, sweating, movement, all those things are in place. The next thing is you can do binders like activated charcoal. You can do sulfur nutrients from food like good healthy protein sources, good healthy plant, vegetable sources that are sulfur rich. And then you can do sulfur amino acids as well. I use my detox aminos that are rich in sulfur aminos. You can also do liver tonifying herbs like dandelion, fringe tree, artichoke, milk thistle. Those are all really great tonifiers. And of course, good binders like activated charcoal too. Is there a test that a regular MD can do to see if we are actually absorbing nutrition and vitamins? Not that it depends. Not a conventional MD could do all of these tests that I do, but the question is, if they're existing in their conventional medical paradigm, no. If they're trained in functional medicine, then they would have access to all the tests I recommend. So for nutrients and vitamins, that'd be like a SpectraCell or an ion panel or a NutriEval or an organic acid. Those will all be great tests to assess nutrient levels as well as different biochemical and or metabolic pathways. Karen writes in, is nutritional yeast and Irish moss a good source of protein, vitamins, and minerals for someone with localized yeast issues? Yeah, nutritional yeast is not like yeast, like fungal yeast. That's higher in B vitamins. I've heard Irish moss is a good source of vegetarian protein. I've heard it's decent. I don't know how you would get it if there's a big supplement now for it, but I haven't seen it in powder form. If you have, let me know. But yeah, you could always do some of those things. Regarding the moss, there may be yeast in that. I'm not sure, but nutritional yeast typically is okay. All right, excellent. Any other questions, y'all? Let me know. The question here, on Facebook. Rona writes in, Dr. J, I'm 67 years old, menopausal female, currently taking DHEA and adding testosterone cream. They're both very low. And long history on diagnosed muscle issues, diet good, no leaky gut, feeling very healthy otherwise. I'm taking 25 mcg of Cytomel, OrthoAdapt, good. What's your question? What would you recommend? So regarding that, everything really just depends. So I'd want to look at where your hormones are at and where your thyroid's at. And then from where I know your levels are at, then I would make specific recommendations. Of course, the big thing is many medical doctors, they get very focused on hormones and they forget about gut. And the gut's really important because that's where you absorb all your nutrition to get all these building blocks in your body and make them all, the hormone-wise. So I'd want to look at the gut and I'd want to know where your hormones are at specifically. Make sure they're at least in the top half of the reference range for thyroid, and at least in the bottom half of the hormone range as a cycling woman. I like the bottom half, the bottom quarter for a cycling woman if they're menopausal. So top end of the postmenopausal range, bottom end of the cycling range. How to reach sphenoid area using sprays. So you could, it depends. I do a nasaline, which is a suction device, and you just press it and it just sprays it right up one nose and down the other. I just did it for my son this morning. He has a little sinus issue and I'm just flushing out so much junk that he would never be able to get out. Is DLPA another way to increase focus? DLPA is more for increasing beta endorphin and for pain. If you eat the same fruit, will your enzymes for the fruit run out? I don't think so. I mean, as long as your gut's functioning healthily, you'll be able to make enough elastase. If you have a lot of gut issues, of course, you can just take more enzymes while you heal your gut. What's the most important nutrient besides diet modifications that I can give my mother with heart disease? I asked for a doctor if I could give her magnesium. He said no. Well, you got to fire that doctor. That's ridiculous. Magnesium is going to be a natural beta blocker, so that will definitely relax the heart. I want to know why. If he says no and it's like, oh, well, this medication is contraindicated, fine. But if he's just saying no, you have to know that medical doctors have virtually zero training in nutrition. And if she has heart disease and she needs a good cardiovascular doc, have her see Dr. Jack Wolfson to get analyzed on the cardiac side. Agnes writes in, wish you more affordable to work with. Yeah, well, just utilize all the free information I have. Start there. And then if you have health issues, then just put aside some money and allocate it when you're ready. But lots of free information here to start out with. Benjamin writes in, what's the best way to repair and protect the gut lining while on anti-parasitic, antifungal? You can always just make sure your diet's really good. Make sure your diet's really good. You can do collagen. You can do aloe. You can do ginger. You can do bone broth. These are all great ways to do that. Roshan writes in, reference online indicates thyroid influences stomach acid production, but can't find details on the mechanism. Any insights you can share on which thyroid hormones influence and how? Well, I mean, I think it's a combination of the fact that the more your sympathetic nervous system is stressed, the more your thyroid and hormones are stressed. So the more your sympathetics are stressed, the more your digestion is stressed, because digestion is a parasympathetic event. So anytime your sympathetics are overly firing, you're going to have adrenal issues, you're going to have thyroid issues, and you're going to have digestion issues. So I'm not sure if it's a direct causal link, but they're strongly correlated via the sympathetic nervous system. What do you think of indoor plants to keep the air clean? I think it's smart. I have no problem with that. How much vitamin D3 should you take when your vitamin D3 is low? Typically, a good generalized recommendation is 1,000 IUs per 25 pounds of body weight, and then retest within 1 to 2 months. Any remedies for CMV? You can look at my antiviral immune podcast, but typically reishi mushroom, silver, monolaurin, those are a couple of good ones to start out with. All right, guys, hope that helped. I'm going to jump on a patient call in the next few minutes. You guys have a phenomenal day and enjoy your weekend. Smash that like button, comments below. Really appreciate it. Helps the YouTube algorithm. All right, y'all, you have a phenomenal day. We'll talk soon. Bye.